Hey guys, I'm gonna put this on 2 channels because many of you guys that follow me, and I have a lot of followers on Ride for Life, Fit for Life, don't really know about my Nurses to Tech channel, and honestly I haven't posted anything there in probably over a year. So I wanted to update both channels and give you this overview of what I'm doing and where I think my industry is going and how this affects just everyday people like you and me. So as you guys know, probably on my channel from years ago, I took a job working in a hospital as a manager of case management, utilization management. Most people don't even know what that is, and I'm going to give a detailed explanation of what that is on my Nurses to Tech, because it ties right into what I do now and what I've been doing for the past 10 years. So I took that job and I was working a lot, sometimes 10, 12-hour days, 5 days a week, on call on the weekends, one weekend a month or every other month, and it was a lot of work. So what I've done recently is I've taken some time off in between things, but I'm still doing my own business, and I'm going to put a link below to a channel called Nurses to Riches, and he's interviewed me a couple times and he'll probably interview me again, but he's a channel that talks to entrepreneur nurses, and I guess you can kind of put me in that category, but I don't really feel like I'm anything special. I'm just a nurse and just an American that works hard. But I do, and I have started several businesses, and I've been successful, and I failed at some too. So let me tell you about what is my latest endeavor, and one of many endeavors. I know you guys know, and I talked about this on my channel, about my heart rate monitor watches, my heart rate monitor straps, my cycling computers, and all that stuff. Well, now the government's recognizing that, and I won't say the government as much as the insurance companies are recognizing that people like Fit Tech. A lot of people have Apple watches, as you know. A lot of people have Garmin watches, Amazon Fit watch, or Amazfit watch, Whoop bands, Oura rings, all that stuff. And so and I talked about it on my channel a while back, the Ultra Human Ring. So what the government, or what the insurance companies realize, is this could be covered under your insurance if you have a health savings account, or if you have a federal spending account in some of those health plans. And those are mostly commercial health plans or government health plans. So if you have those health plans, you can actually have these items paid for through that account. And it's kind of cool because you basically have that account to spend on more fitness related or more health related products, not necessarily having an insurance plan just to spend on stuff when you're sick and you're wrecked, but you can have stuff to spend on when you are using stuff to maintain your health. And I like that aspect of things, and I totally agree with that standpoint. Another thing, and I've talked about this before on my other channel, and if you look back on my Nurses to Tech channel, I've put some different videos up of RPM companies. And RPM stands for Remote Patient Monitoring, or Remote Physiological Monitoring. And it's combined with another thing that's very prominent on the East Coast, but for some reason on the West Coast, it's not as prominent. And that's CCM, Chronic Care Management, or Chronic Condition Management, or Complex Care Management. And those programs are covered for everybody that has Medicare Part B, either assigned to a managed care organization or unassigned. What that means is a lot of elderly, what they do with their Medicare Part B is they get marketed to basically on all these infomercials. They call a phone number and then they get it switched over to Humana or to Kaiser, like the company I was just working with. And I wasn't a full-time employee for Kaiser, I was a contractor and under an independent contract, so just to make that clear. And those programs basically have nurses that manage you or help you and talk with you in between office visits, in between your hospitalization, in between perhaps maybe having to stay at a skilled nursing home or having to have home health care or something like that. But there are nurses that do the consulting to you directly, almost as a concierge service. It's very, very much like a concierge service in between those clinic visits and office visits directly with that physician. That's sometimes only a 10-minute appointment. You spend most of your time in the waiting room or talking to other people besides physicians. So the advantage of that RPM combined with CCM is you have a nurse that can see the data from the remote physiological monitoring, very similar to your Garmin data, but they're seeing a heart rate or a pulse ox or a weight on the weight scale or a blood pressure that is you're continually using every day, perhaps after you take your medicines or perhaps before you go on walk your dog. Many different incidences, but those things are becoming more and more prevalent. Matter of fact, you can order a blood pressure cuff or even this thing that does your EKG on Amazon, and you can pick them up at many pharmacies and drugstores and Costco and Walmart, so on and so forth. So the difference is with a program that's reimbursed by your insurance and you don't have to pay for, or a program that you can use your HSA or FSA account, is you have to have something that's been approved. For Medicare, it has to be FDA, Federal Drug Administration approved. For FSA and HSA, it has to be approved through a similar process, but not quite as stringent. That's why they allow a lot of fitness products and common stuff as a weight scale. So if you have these benefits, the goal is to use them. The goal is to not wait until you're very sick and you are having medical problems to see a doctor and get seen by that doctor, get placed on medications, go home or go on home health or go to a skilled nursing facility, or maybe you can't even go home right away. You have to stay a few days in a hospital, but then after that you go home and you have very infrequent to very seldom follow-up, and the follow-up is not very comprehensive and normally does not include any vital sign statistics, your weight, your blood pressure, so on and so forth. But there's a group of doctors and nurses along with me that have built these programs, and we work directly with the practices, that's your physician practices, and we work directly with the tech companies as the liaisons, if you will, to be coordinating this concierge medicine. So I hope that explains it. I'm going to do some breakout videos, mostly on my nurses, the tech, but I want to put it here too because I think that you guys are great for following me and liking my videos. As you see, I don't just talk about health and fitness, I do it. And I'm not a young man. I'm close to retirement. So I want to influence you to ride for life, stay fit for life, but also stay healthy for life and increase your health span. Anybody can increase their lifespan and get medications and treatments that'll make them live longer. But living longer and living with a chronic condition where you are bedbound or you can barely walk up a flight of stairs that's not early living to me. So I don't think it is to most of you. And I will land my plane right there. I will talk to you guys later. I'm going to do some highlighted videos of people that we are helping. I'm going to do some highlighted videos of companies that we are working with, so on and so forth. You guys could even make a suggestion of what you would like to see. Maybe it's a particular company that you use their products, the Ultra Human Ring or the Fitbit or the Whoop Band or something like that. I have nurses and doctors that we've tried them all, we've done them all, and we're happy to share that with you in this format. And I'll talk to you guys later.